Hi, good afternoon, good day. My name is Ernest Nolan. I am currently a registered nurse working at University Hospital Medical Center here in Tamarack, Florida. I've been a practicing nurse for the better part of the last 15 to 20 years. Um, and I was recently actually asked by a friend of mine to respond to my pharmacology experience um, while at BC. Um, there were several questions that were handed to me in response to what my experience has been. One of the first questions I was asked was, what have I learned in my pharmacology class that really applies to my practice of nursing? There are many things actually that I acquired, or at least much knowledge that I've gained from doing that pharmacology class. Not the least of which is learning the different classifications of drugs, having some understanding about the medications that we ultimately administer to our patients is of crucial importance in the healthcare industry and more specifically in the field of nursing. Additionally, it's very important that as a nurse that you understand um, the drug dosages, how to calculate drug dosages. Granted, many of the drugs are the calculations actually done for you by a licensed pharmacist, but nevertheless, you need to have some knowledge and some experience as to how to calculate drug dosages. Also, to understanding how to convert, say, for instance, kilograms to pounds and pounds back to kilograms are also a vital part of our nursing profession. For those of you who may probably have aspirations to get into peds, for instance, it's very important that you note and you understand that the weight of the child is extremely important in how much medication is administered and how they go about to calculate the drugs. So there is a lot of things in the pharmacology program that you will understand and you will know, and that will give you some insight and some knowledge as to what the drug dosages are, the different classifications of drugs, and how to administer these medications. So it's important that you have some knowledge in terms of the drug calculations. There was one other there were other questions that was asked. How did they manage to pass the pharmacology class in college? Um, that was a challenge. Um, I was not exactly what they would say very mathematically inclined. I struggled throughout my entire career, particularly in high school, in terms of gaining and understanding math. So it was indeed a struggle for me. Needless to say, I spent many days and nights either at home or at college, just going over a lot of the calculations, making sure I understood how they work, how they are applied. I actually seek the knowledge of many of my classmates in terms of better understanding the whole pharmacological concept. But yes, it was a struggle. I I would employ anyone that's interested or have any pursuits to get into nursing. That is important that you spend as much time as you can studying, staying focused, staying on task. Also keeping in mind that nurses are we play a very vital role in terms of impacting other people's lives. So understanding that the drugs that we are given can have either a positive or negative effect on the patients are very, very important for us. So yes, I've actually made it through the class, but it was not without a struggle. I Another question that I was asked as well was, what advice do I have? I can give to the nursing students Basically, I mean, it's an old cliche, yes, but just basically study. If you, like anything else in life, you want to succeed, you want to achieve a particular goal in life, you just have to work hard. It involves, some nights staying up late, some days when you're off from work or whenever you have some downtime, spending time at the library, again, soliciting advice from classmates, even reaching out to your teachers,